Children's Cancer Institute is solely focused on finding new treatments to cure kids of cancer. There are 300,000 children diagnosed with cancer every year, and very sadly here in Australia, 3 children die every single week.
We're really trying to work out how we can improve outcomes in kids with cancer. And we're trying to take a precision medicine approach, which means we're going to measure lots of information as much as possible. Inherently, that produces an enormous amount of data that really makes this a data science more than a biological experiment.
This year's 20 years since I went through having chemotherapy myself, and back then they gave me 6 months of chemotherapy. It's a blanket approach.
Kids get different cancers than adults. You can't just take the treatment you would give an adult and in some way dilute that and pump that into the body of a growing child. You will not get the results that you need.
Every childhood cancer is different, so the more children that we can get through this program, that's really something special.
When we find new discoveries through our research at Children's Cancer Institute, we always do that in collaboration with other centres around the world. And the reason we do that is that we need to have clinical trials that open with more children involved.
At the Children's Cancer Institute, we have an in-house high-performance computing system which really didn't scale very well for the terabyte per data challenge.
So coming with Equinix, they get access to a whole range of public cloud service providers, network service providers, and other medical research institutions where they can interconnect directly inside our 4 walls and speed up that diagnosis timeframe.
Equinix allows us to have a direct, secure connection into our cloud providers and fundamentally connect globally to our collaborators so that we can seamlessly integrate with their systems and our systems.
So we can take our data that we're generating in-house, compare it to data generated at Philadelphia or Memphis or Heidelberg, and bring this data into the same cloud environment so we can start to find that signal in the noise.
The partnership between the Children's Cancer Institute, Optus and Equinix has been able to provide us with a solution without needing the carrier costs involved in setting up a connection.
We really believe that this opportunity to partner with Equinix and their global network of data centres will allow us to beat this challenge, will allow us to integrate our data from Australian patients with data that exists overseas and help to understand and make insights into this disease and ultimately overcome paediatric cancer for good.
Every single day, we all come to work with one goal in aim. We are all here to cure every child of cancer, and we know we're going to do it. So that passion when you walk through this building is palpable.
What the Children's Cancer Institute of Australia is doing is revolutionary. I'm proud to be part of a company that is able to assist in the process and also fully invested in the mission of CCIA in curing childhood cancer.